Hello, my name is Stephanie. I'm a nurse practitioner student, and I'm going to do your head to toe assessment today. Okay, before I came in, I washed my hands, I closed the door to create a private space for us to be examining you, and I had my medical assistant come in and do your vital signs. So she said you were a 6-foot tall male and you weigh 180 pounds. You have a 24.4 BMI, which is great, that's within normal limits. Your vitals were 98.6 body temperature. Your respirations were 12. Your blood pressure was 110/65. That's very good. Your pulse ox was 98, and that's very good as well. So I'd like to start your assessment. I'm visually assessing you, and I'm looking at your skin tone. Your skin tone looks very good. I don't see any lesions or rashes, nothing that's visual to the eye. I don't see any lumps or nodules that are visual to my eye either. I'm going to put on my gloves so I can do a physical examination of you. I also have a couple questions I'm going to ask you. Can you tell me your first name?
My first name's Carl.
Very good, Mr. Carl. Do you know where you are right now?
I do. I'm at the doctor's office.
Okay. Do you know what year it is?
It is 2025.
Can you tell me some type of current event that has happened recently?
Currently, I think that there's a war in the Middle East.
Great. So you're alert and oriented ×4. So I'm going to start looking at your hair. Okay. Your scalp, no lesions. Your eyes are symmetrical. Your ears are symmetrical. I don't see any dandruff. I don't see any rashes in the hairline. So that all looks good. I'd like to check your cranial nerve 7, which is your facial nerve, and your cranial nerve 12, which is your hypoglossal nerve, by asking you to do a couple things. Can you smile for me? Can you clench your teeth? Can you scrunch up your forehead? Scrunch your eyes? Can you stick out your tongue? Straight at me. Go left, right. Can you puff up your cheeks like that? Okay, very good. Now I'm going to do the 6 cardinal positions of gaze, and I'm just going to ask you to do a couple things. And if you could follow my finger, you're just going to sit with your head facing directly towards me, like you are, and you're just going to follow me with your eyes. So you're going to just look at my finger. Okay, I'm going to back up a little bit with my eyes. Okay, with your eyes. I'm sorry. Okay, so follow it this way. Very good. Your eyes are symmetrical. I don't see any issues with the separation of your eyes. I don't see any nystagmus or strabismus. I think that your eyes look very good. They're moving together with movement. I'm going to check your eyes now with my light pen. Okay, so it's going to be a little bright, okay?
Mm-hmm.
And I'm going to check it for perla. Okay. Your eyes are equal, round, and reactive to light and accommodation. They're about 3 to 5 millimeters. Okay. And I want to get my ophthalmoscope. Okay. So because I don't have one, we're just going to pretend we have one. We're going to use this to just imitate having one. Okay. So I'm just going to look in your eyes. Your sclera is white, your conjunctive is pink, your retina and macula look good, okay? And before I came in, my medical assistant had you do a Snellen and Rosenbaum chart test. Your vision was 20/20, that's excellent. So that's within normal limits, and that's an excellent vision. All right, I'm gonna get my otoscope to check your ears. Okay. And for the sake of this test, I don't have an otoscope, so we're going to pretend that this is an otoscope. Okay, I'm going to look at your ear canal. Okay, each side. Don't mind. Check this side. You turn your head, just leave it straight like this. I am now looking at your auditory canal. Okay, I can see your tympanic membrane. It's pearly gray and intact. I don't see any discharge. Okay. Okay. All right, that looks very good. I'm now going to palpate your lymph nodes, if you don't mind. So I'm going to physically touch you right now. Okay. I'm going to feel your lymph nodes to your head. I don't feel any nodules or edema. I don't feel any lesions. I don't feel any crevices or unevenness. Okay, I'm going to do the whisper test. Okay, and I'm just going to come behind you on each side and I'm going to say something and you're going to repeat it back, okay? Okay, I'm going to go on this side first. 55.
55.
Very good.
Fall.
Okay, I'm going to come on this side.
33. 46.
Very good. Okay, now I don't have a tuning fork, but I'm going to act like I do. I'm going to act like this is a tuning fork. And what I'm going to do is called a Weber and Renee test. And what I'm going to do is going to check your ears, okay? So I'm going to hit the tuning fork like this, and it's going to, I'm going to put it on the middle of your head. So when I do this, this is the Weber test. And what it does is, if it was an actual tuning fork, you'd hear a sound in each of your ears at the same time, okay? And then I would hit it again with the Renee test, and I would hold it next to each ear to make sure that you equally, symmetrically on each side heard it. Do you hear it?
I do.
Okay. Okay, so I want to check your nose, and I am actually going to use my light to look into your nose. I have been visually inspecting it. Your nostrils are symmetrical, so that does look good. If you could just put your head back just a little bit. I'm going to look into your nose. Okay. Very good. Normal mucosa. It's pink, moist. There's no deviation. Okay. Can you hold your finger on one nostril? Can you breathe in the other? Very good. Can you switch sides? Same thing. Okay, that's normal. Okay. Also, I'm going to have you, we're going to pretend to do a smell test. And I'm going to say this is an orange. Can you smell it and tell me what you smell?
It smells like an orange.
Very good. I'm also going to use this as a fake tongue depressor. And I'm going to look into your throat. So if you can open your mouth. Say ah. Okay. I see you have no lesions. Your teeth are intact. Your lips are moist. So there's no dehydration. Absent tonsils, you must have a tonsillectomy. You have a normal palate, and it's pink and moist in your mouth. I don't see any lesions or anything, so that is good. Now I'm going to look at your neck, okay? And I am going to palpate your thyroid, but before I do that, I would like you just to tilt your head back just a little bit, okay? And then slightly swallow. You can take a look. Okay, very good. I want to palpate from the front. You can put your head down. Okay. I don't feel any nodules or lumps. If you could just turn this way a little bit towards the camera, and I would come behind you and evenly, if I was able to go directly behind you, I would feel your thyroid on each side. Okay, and I don't feel any nodules. Doesn't appear to have a goiter, so that's good. Okay, now I'm going to get my light and I'm going to look at your JVD, your jugular vein. So what I'd like you to do is turn your head that way. You don't see any distension. You could turn your head this way. I don't see any distension. I'd like to now listen to your carotid artery. And I'm going to check for any bruise. I'm going to use my bell. You just breathe normal. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, Okay, that sounds very good. I don't hear any bruise, which is excellent. Okay, so now I'm going to check your carotid pulse. Okay, that's very good. It's not thready. Feels good. Okay, now I'm going to check, you're going to palpate your lymph nodes. I'm going to feel your submandibular, tonsillar, post-auricular, pre-auricular lymph nodes. They all feel soft and mobile. I want to feel your occipital. When I see your trachea, you look right at me. It appears midline. I don't see any type of shift, so that's normal. We're going to do range of motion with your head. So what I need you to do for the flexion and extension. So for flexion, you're going to go forward with your head. Okay. Can you put it back for the extension? Okay. Lateral, we're going to go left to right. Very good. And then rotation, if you could just rotate your neck around, I could just see. Okay, very good. Now I'm going to check your thoracic cage. So I just want to see where your thoracic cage is located. It's normal on this side. I'd like to examine this side, please. It's even on this side. Okay. You look like you have good color. Okay, so your thoracic cage is normal. I'd like to check your shoulders, and if you could shrug your shoulders up like this, okay, and let it down. And then I'm just gonna hold it, put them up again. Don't let me push them down. Okay, so your muscles are good. Your muscles and your shoulders are symmetrical, so it's very good. Okay, I want you to turn, actually, can you turn that way? And I'm going to check you for tactile firmness. Okay, so it's gonna feel a little strange. So you're gonna say 99, and I'm gonna feel. Okay, if you say 99.
99, 99, 99, 99.
Okay, very good. You could just sit forward facing me. That's all within normal limits. Okay. What I'm going to do next is I'm going to inspect your spine. So you're going to stand up over here. And if you could come this way in the camera. Just, can you bend over a little bit? Okay, is there any tenderness?
No.
No pain?
None.
Okay. So your thoracic area, your lumbar area, and your cervical area up top. Okay, you can sit back down. Oh, sorry. There you go. And if you could face this way again, I'm going to do another test on you. Okay, so I want to percuss for resonance. Okay, so what I'm going to do is I'm going to tap the area. Okay, you can sit back. All right. So, did you have any pain or anything when I inspected your spine?
No.
Okay. So what I'm gonna do next is I wanna listen to your breath sounds. Okay. Okay. I'm gonna get right next to your clavicle. Okay, listen there. Can you face the camera actually a little more? So we go to 10 spots. There, there. 1, 2, 3, 4, 5, 6, 7, 8. On the sides. 9, 10, listening to all your lung sounds. What I'm listening for is to see if you have any wheezing or crackles, and you do not. Everything sounds good. It's within normal limits, so that's excellent. That's good, so it sounds good like that. I would like to actually have you turn back around, and I want you to say, just turn on this way. Okay. Let me just see. Can you say the letter E?
E.
One more time.
E.
One more time.
E.
Okay. And I'm gonna listen to your heart sounds. You okay?
Mm-hmm.
Okay. Okay, so I'm gonna go to your second intercostal. And I'm gonna listen to your apical at S2. And then I'm going to go to your second intercostal on your right side. I'm listening to your pulmonic artery. And your third intercostal, your herbs. And I'm going to switch over to my bell. And I'm going to go to your fourth intercostal. I'm going to listen to your tricuspid. And then I'm going to listen to your mitral valve, which is S1. I don't hear S3 or 4, so that's good. Seems like you have 70 beats per minute. That's what it sounded like, so that's within normal limit. Okay, if you could lay down. I'm going to fill your recording in. I'm going to go over the apex of your heart. Just want to feel. Sorry. Is it uncomfortable?
No, it's fine.
Okay. Okay. There's no heaves or lifts. So that's good. I also want to feel back down to the fifth intercostal. This is your PMI. I'm locating your PMI, which is the point of maximal impulse, the apex of your heart. It's going to be under your left nipple, so that's going to be your fifth intercostal. That feels good as well. Okay, you can sit up, and I want to look at your upper extremities. I notice that your skin doesn't have any rashes or lesions that I'm looking at. I want to examine both of your hands. If you can put your hands out. Okay. Turn them over. Okay, turn them back over. There's no clubbing in your fingers. Capillary refills within 2 seconds. I'm going to do your skin turgor. Notice there's no tenting. You're not dehydrated. I want to check your pulse. So take your brachial. I'm going to do the brachial pulse right here. Push over to this side. Okay, very good. I'm going to do your radial pulse. It's going to be over here. Put your thumb on your wrist. That feels good. It's not thready. Normal rhythm. Okay, I'm going to do your range of motion with your flexion and your extension, and also your rotation. I'm going to do it on your shoulders. So can you shrug your shoulders up and down? Okay. Okay, can you take your arms, move them up and down like this? Okay, can you go like this with your arms? And then down. Okay. Can you take your elbows and go like this? Like a scarecrow? Okay, you can put them down. Can you take your hands like this? And can you put your supination and pronation with your hands in and out? And then can you take your hands at your wrists and go like this? Can you take them and go up and down? Like that? Okay. Do you have any pain or tenderness?
None.
Okay. So what we're also going to do is the Tenean Fallon sign. So you're going to take your hands like this, if you could put them together. Yep. just like that for me. Let me look at it and just hold it for a second. Okay, that's the Fallon sign. Okay, if you could give me your hand. And take your wrist. Tap right here. Okay, checking for the time. No, any type of numbness or tingling from either of those?
No.
Okay, that's great. Okay, you can lay down, please. Put your head that way. I'm going to listen to your bowel sounds, if that's okay.
Mm-hmm.
Okay, so. Okay, I'm going to start in your right lower quadrant. Okay. Going to go up to your right upper quadrant. You hear gurgling, left upper quadrant, left lower quadrant. Okay, and now I want to listen to your vascular sounds. Okay, I'm going to listen to your renals on each side and your aorta. And I would do your femoral and your groin, but we're just going to pretend that I do that, okay? So, but it would be right here, okay? Let me listen over your, let me turn that, over your right upper quadrant. Just want to make sure on your left upper, oh, sorry, right upper quadrant and your left upper quadrant. I don't hear friction rub. Send it over your liver, okay. Okay, I'm gonna tap on my knuckles, what I'm gonna do, so you know, excuse me, so you know, I'm gonna listen, I'm gonna tap on my knuckles when I'm checking for some dullness in the area, so if you could just tell me if you're uncomfortable, okay? Or you feel any tenderness. Did you feel any tenderness
No,
or
I
any
didn't.
pain?
Nope.
Okay. All right, I also want to assess for splenomegaly, and what I'm gonna do, I'm going to tap over your left upper quadrant, okay? That's a dull sound, so that's normal. I'm going to palpate all 4 quadrants. Tell me if you have any pain.
No.
Any pain?
No.
Okay. I'm going to assess for rebound pain, so I'm going to feel over here, go to your right lower quadrant. Press in. Were there any pain with that?
No.
Okay, great. I also want to palpate up here. Take a deep breath in. Deep breathe in.
No pain.
No pain? Okay. Okay. I want to feel down here again. I'm going to look for McBurney's sign. So you tell me if you feel any burning when I press in.
No.
Okay, good. Okay, so I'm gonna feel down. I want you to sit up again real quick. I'll help you up, put your feet down. Okay, so what I'm gonna do is I'm looking for your costovertebral angle, which is your CVA. It's on the 12th rib on your back. So I'm gonna look down your 12th rib. I'm gonna count down it on your back. I'm gonna thump on my hand. Do you have any pain?
No.
Okay, because I'm checking for a kidney infection. Okay, and then I'm also gonna check for some dullness on your back. There's no dullness, that's normal. I'm checking for ascites. I'm gonna have you lay back down. Actually, hold on one second. I'm gonna have you do, what I'm gonna do is I'll have you lay back down. Yeah, lay down, please. Okay, so we're gonna check a couple things for appendicitis. Okay, so I'm gonna check for the Rosving and sign, and that's gonna be in your left lower quadrant, okay, which is right here. I'm gonna do a dip in. You're gonna tell me if you're gonna have any pain.
No.
Okay. Then I'm going to check your right leg for the psoas sign, or your right knee right here. Can you lift it up? I'm gonna push down. Tell me if you have pain.
No.
Okay. You can put it down. That's fine. I'm gonna check your obturator sign, and what I'm gonna do is have you turn on your left side. Just watch right there. You don't fall off. Okay. Got that? So if you lift your leg up for me, bend it, check it this way. Any pain?
No.
Okay, very good. You can go back on your back. Just be careful you don't fall off the table. Okay, lay down. I'm going to check for Murphy sign, and that I'm going to check your right upper quadrant. Okay, so I'm going over here. Have you take a deep breath in. I'm going to press in. Any pain?
No.
Okay, that's good. So that means that that's a negative sign. Okay, I want to check your lower extremities. So I see that your hair is equal. You don't have any on your legs. There are no rashes. It's not shiny. The skin is intact. So that's good. There's no varicose veins. Your skin temperature seems cool. I'm going to check, what I'm going to check now is your pulses. So your femoral pulses. I'm not gonna check them, but I'll say I'm checking them. Your popliteal pulses are right here, behind your knee. Okay, see, I feel that. Okay, your inner ankle. Let's check your posterior tibial. And your, let me check both. Your dorsalis pedal pulse is in the middle of your foot. They feel good. Okay, you're going to do range of motion. You're going to put your leg up, touch your heel like to your butt. You can put your other leg up as well. Okay, so we're checking range of motion. You lift your leg up. Okay, can you push it down? Okay, can you push it up? Your strength, you have good strength. You put that leg back down. Lift this one up. Can you push down? Okay. Push up. Okay. I'm going to move your hip to the side and rotate. Okay. Put that down. Take this leg and check your hip. Okay. Push your leg out. Okay. I would do that side, but you're close to the wall. So if you push out, okay, you have strength there as well. Okay, great. You could sit up again, please. Just be careful you don't sit off the table. I'm going to do a quick neurologic exam. You can move over a little bit this way. This way. Okay. So we're going to do your neurologic status, okay? So what we're going to do is your cerebral function. So I'm going to do a test where you do finger to nose. So make sure you're in the, maybe you should come over here a little more and face this way so the camera could see you. Okay, that good? Let me see if you're in it. Okay, so you're gonna look right at me, and what you're gonna do is you're gonna touch your finger to my finger to your nose, as quick as, like, pretty quick. Perfect. Okay, we're gonna do heel to shin. So you're gonna take this heel, you're gonna rub it up your shin and down. Once, you're gonna start from the top, not up and down, just once down, okay? Then the other side, same thing. Okay, very good. So I'm gonna check the sensation of your face right now. Can we feel the same on each side?
Same. 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 Same.
Okay, we're gonna pretend that I have something that's broken off that's a little sharp. You're gonna tell me if you feel a sharper sensation.
Yes.
Is it the same on each side?
Yes. Same. 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 Same.
Same on every side?
Yes.
Okay, so that's great. So I'm going to check your reflexes right now. So what I'm going to do is check your triceps. Okay, so just be careful, don't fall off, and I just want to be able to get you on the camera. Okay, so I'm going to do your triceps, which is, if you could, I'm going to pretend that I have a reflex hammer. So you're going to put and I'm going to hit it like this. So these are your triceps. I'm going to hit it like this. If I had a reflex hammer, it would obviously make your arm go out. Okay, I want to do your brachioradialis, okay, which is going to be the top of your wrist. Okay, perfect. I'm going to do your patellar, which is right here for your kneecap, right underneath your kneecap. On each side, I would do both sides. I'm going to do your Achilles. Okay, it's behind your heel. Okay, very good. Okay, so what I'm going to do also is see if you could do a shallow knee bend. Is that possible?
Yes.
Stand up. Okay, just don't fall backwards. Okay. All right. So we're going to do some. Okay, can you turn around and do a normal walk towards me? Normal walk, front and back. You can turn around and go back. And then can you also walk on your heels towards me? Heels. And then back on your heels. All looks normal. Okay, you're going to walk on your tippy toes towards me. Perfect. Tippy toes back. Okay, I'm going to do a Romberg test. Okay, it's going to test your cranial nerve 8. Is that okay?
Yes.
Okay, so you're going to come this way, turn this way out. You're going to put your arms straight out, both arms, and you're going to not lean against the table though. Come forward. You're going to close your eyes for a second. Okay, so that's a negative Romberg test. You're testing your vestibular. I'm also going to test your range of motion with your spine. So if you can, I'm going to do your range of motion with your spine. So what I'm going to do is see if you could bend over and touch your toes. Very good. Stand straight up. Lean back a little bit. Okay. Just want to make sure that's your extension. Leaning back, flexion, lean forward. Let's do lateral bending, which you're going to put your arm down to this side, like go like this for lateral bending, and then the opposite side for lateral bending. See if you could do rotation in a circle with your hip. Okay. Very good. Okay. All right. Thank you very much. That concludes our exam.
Thank you.